Okay, welcome everybody. We are just going to wait another minute for people to join. See, we're starting to get a nice full house. Okay, just another few seconds and then we'll begin. All right, I think we've filled out nicely. So, hello everyone from around the globe, I guess, and welcome to How Pediatric Care Adapts, leveraging generative AI for millennial parents. And thanks for taking the time to join us. Big shout out to our panelists who will be sharing their expertise today. Let's give a warm welcome to Patrick Jordan, Director, Virtual Access and Consumerism at Boston Children's Hospital, J.D. Whitlock, Chief Information Officer at Dayton Children's Hospital, Charity Darnell, VP Chief Clinical Informatics Officer at Cook Children's Health Care System. We will hold a live Q&A session at the end of our conversation, so make sure you stick around. And throughout the panel, you can go ahead and ask your burning questions in the Q&A tab you'll see on the side, and we'll try to get to as many of those as possible throughout the hour. And before we get into today's talk, so I'll just quickly introduce myself, the moderator. So I'm Aaron Bours, VP Marketing and a founding team member here at Hyro. Been here for 4.5 years now. As you can probably tell, I am a millennial, and though I'm not a parent yet, I did just get married. So I think hopefully I'll be on the way soon. And before we jump into what I'm sure will be an illuminating panel discussion, I'm going to set the stage so we can try to better understand the largest parent population in the US. So, millennials. Millennial is anyone born between 1981 and 1996. There are 73 million millennials in the US. Of that, 22 million are parents, so about 30% of all parents are millennials. And every day, 9,000 babies are actually born to millennial parents. So it's pretty crazy stats to understand. And basically, that makes them the largest parent population to children under the age of 18 in the US, and that's 33% of all parents. So what makes millennials tick? Not a question we can cover with a single slide for sure, but these stats are pretty indicative of what millennial parents have come to expect. So 60% of millennial parents say they're constantly stressed about their child's health. 75% of millennial parents seek parenting advice online, and 90% of millennial parents are social media users, compared with 76% that are Gen Xers and 59% of baby boomers. If you ask me, it's more like 99% of millennial parents. But what are their expectations and views on their children's pediatric care? That's what we really care about today. It's not a question, again, that we can answer on one slide, but let's take a gander. So if there's one slide you want to take a screenshot of and share with your colleagues, it's probably this one. 80% of millennial parents expect an immediate answer when contacting a provider. 71% of millennial parents expect to be given the ability to book appointments via mobile apps or online portals. 80% of millennial parents expect personalized care experiences. And I would love to hear some of the audience members' thoughts on this in the chat. So does this align with what you're seeing? Does this kind of align with expectations you're seeing when you're serving millennial parents within your health systems or in your clinics? And if we try to decipher what millennial parents want from their pediatric care providers, right, I think we can probably agree on three major pillars. So personalized care experiences, constant and fluid communication, right, instant access, and ease and convenience of service they become accustomed to as tech-savvy consumers in this new digital age. And we'll get back to these in just a minute. But now that we've covered the patient side of things, let's talk about some of the challenges facing the 220 children's hospitals in the US tasked with serving these millennial parents. So of course, labor shortages, nothing new here. Everyone's probably heard of the crisis going on in healthcare in terms of labor shortages, or you're experiencing it every day. In 2021 alone, 230,000 healthcare providers quit their jobs. Salesforce estimates that by 2030, there'll be a global shortage of over 10 million healthcare workers. Mark Wiatecha, he's the CEO of Children's Hospital Association. He estimates that pediatric hospitals are unable to maintain as many as 10% of all their beds because of staffing shortages. So that's one major issue. While we have staffing shortages, hospitals are also dealing with an unprecedented youth mental health crisis, and that's sparked by COVID, but not just. Deputy Dean at Brown University School of Public Health estimates that 20% of all pediatric emergency room beds at one of their hospitals is actually occupied by children experiencing mental health issues. So a huge, an unfortunate epidemic there. And lastly, pediatric hospitals are grappling with lower per patient reimbursement rates. So 40% of US children covered by Medicaid. That means that significantly lower base rates are coming in when compared with private insurance. So just quite an array of problems plaguing children's health systems at the same time. So let's recap. Millennial parents expect personalized care, constant communication, ease and convenience of service. Pediatric hospitals are dealing with labor shortages, mental health crisis, and lower per patient rates. So what does that have to do with generative AI? Right? Well, generative AI can be a powerful tool to help tackle these challenges in creative and new ways, delivering and even exceeding millennial parent expectations. So generative AI-powered digital front door in the form of AI web assistants, providing immediate answers to concerned patient and parents, can improve patient satisfaction, while also deflecting a lot of those inbound calls, messages away from support staff that's either overextended or non-existent. Generative AI can also expedite and streamline clinical documentation, so freeing up physicians who are burnt out to focus more on care than they do on that office work, repetitive tasks. And then under clinician supervision, of course, Gen AI has the potential to produce discharge summaries, generate care coordination notes, create shift handoff records automatically, drastically reducing administrative overhead and maximizing some of that net patient revenue that we just talked about being lost. So all this is exciting, but whether it's for clinical, administrative, patient-facing use cases, there's obvious concerns with emerging technologies like generative AI. There are also ways to mitigate those concerns. So at Hyro, we're a conversational AI company. We believe there are three major pillars to prioritize when implementing generative AI within highly regulated industries like healthcare. So one, control. The ability to rein in technology on your terms, clearly defining the workflows based on enterprise needs, creating boundaries for data sources, and maintaining visibility into how those changes in the model or data will affect your deployment. Compliance, adhering to best practices that minimize liability and maximize trust from your patients, remaining true to HIPAA, making sure the PII redaction remains intact, using technologies like knowledge graphs, that's really big for us at Hyro, as guardrails to make sure the data is clean. Finally, explainability, so comprehension and clarity around why and how AI gives answers. You don't get that with machine learning, right? It's a black box, but understanding the outputs will become critical moving forward, being able to account for them and guaranteeing constantly improving accuracy. With those three pillars in mind, we've created Spot. It's a GPT-powered assistant, streamlines FAQs and search as part of that new age digital front door we just talked about. And it's designed to exclusively use information from pages scraped from your organization's website to avoid unrelated or inaccurate information being relayed to patients and employees alike. We don't use machine learning, so we guarantee explainability and supply health systems with clear insights into why and how AI outputs are provided to patients. And with multiple guardrails in place, we only relay answers to patients with a high degree of confidence. So that drastically cuts out hallucinations, which are pretty scary otherwise. Summa Health, Weill Cornell Medicine are some examples of healthcare organizations already embracing Spot, using it to answer patient queries and keeping staff less overloaded by automating a lot of the inbound inquiries that they're getting to their website. We're offering a free trial, so feel free to ping me or go to our website and stick your email in the form, and we'll get that over to you. Spot's just one of the things we do at Hyro. I won't go too deep, but we're automating 60 to 85% of repetitive tasks across websites, call centers, mobile apps, and more for some of the best health systems in the US, Intermountain, Baptist, Mercy, and it's all for patient-facing use cases, prescription refills, appointment scheduling, patient registration, things that you can kind of offload to AI assistants without taxing your staff. So great. Now, without further ado, we talked about Gen AI, we talked about millennials, we talked a little bit about Hyro. It's time to kick off our live fireside chat. And I'm really excited to now hear from 3 amazing panelists that we brought on for you. So Charity, we're going to start with you. Can you please introduce yourself and tell us a little bit about your role at Cook Children's, some of the interesting projects you work on?
Yeah, no, thanks for having me. In fact, as you started, I thought, well, I'm not really sure we're all going to have that much input since you laid out all of the things that we need and all the challenges that we have. But my name is Charity Darnell. I'm the Vice President and Chief Clinical Informatics Officer at Cook Children's Healthcare System in Fort Worth, Texas. We are an integrated healthcare system with 9 companies, and we just opened our second medical center in Prosper, Texas, in January of this year. So I'm currently responsible for Epic Clinical, all of our Epic Clinical applications, third-party clinical applications, biomed, as well as our training team and our informatics team. So I have the privilege to get to have conversations with our patients and our families and our clinicians alike to hear, where are they experiencing friction and how do we reduce that friction? And so I really am excited about some of the work that we're doing. I'm going to be real transparent in that we are just starting our AI journey at Cook Children's. I think in pediatrics, and for many of you on the call, you may be experiencing something similar, which is, I think healthcare is really risk averse. We're really risk averse, and especially in pediatrics, because we want to ensure that we are not causing harm to our kiddos and the patients and families that we serve. And so we've not been early adopters of AI, but our fiscal year, which starts next month, we've got 4 projects that will include the use of artificial intelligence. And as we talk today, hopefully can dive into some of those use cases that we are looking at for next fiscal year.
Amazing. Great intro. And sorry if I stole some of the thunder in the beginning.
That's okay. It's fine. It's fine.
But it's great because some of the things I said, by the way, you don't have to agree with at all. Maybe we'll have some dissent on this panel as well, and I think that'd be great. So moving on to JD, why don't you go next and tell us a little bit about your role, Dayton, and some of the interesting projects you're working on,
Sure thing. So JD Whitlock, CIO at Dayton Children's, been here for about 5 years. Dayton Children's is a smaller pediatric health system in Dayton, Ohio. We are on Epic, which factors into this discussion because some of the capabilities we talk about make sense in Epic world and not other places. We are, on this particular topic of millennials. And by the way, you really have to say Gen Z and millennials when you're talking about the parents of our patients, because the oldest Gen Z are now 26 years old, and obviously they're having kids. And they are obviously the true digital natives, so their expectations are even, just amplified from what we were talking about earlier. In terms of now, to Charity's point about being early with the generative AI, well, of course, everybody's early with the generative AI because it's so new. And of course, we have to be careful about this. There's legal risk and all sorts of risks we need to pay attention to here. We also need to, I think it's also important to say, because the term AI gets thrown around so much, and depending on what you mean, and depending on what vendors say we're using AI, and 90% of the time they mean they're just doing some predictive AI that's not particularly new, right? So predictive AI, generative AI, we have to be very responsible in healthcare about implementing them because it's completely different, right? The predictive AI, you can measure that. You can measure the power of that predictive algorithm that you're going to decide to use or not use in your health system. You're going to put in some clinical decision support, into your EHR that your providers are going to use. That's been around for a while. Generative AI is a completely new thing, And because of the hallucinations and everything that we're all reading about, we do have to be very careful about that. Also, in terms of the slide you had up there, Aaron, about expectations for younger generations, of course, we in pediatrics, we have to be double, triple concerned about that. All health systems should be concerned about that, but it's definitely of increased importance for pediatric health systems. And there are absolutely things that we are looking at doing, and hopefully we'll be doing in the not terribly distant future, that really do leverage true generative AI in responsible ways. There are also things that we should be doing to make that experience better that don't require generative AI, that most health systems are doing now, but not all health systems are doing now. And simply having, for example, younger generations don't answer their phone anymore. So if you want to get a hold of them, you'd better text them. So having a capable SMS platform that's well integrated with your EHR is pretty important these days. We've been doing that for about 3 years and use that pretty effectively. And then the good old fashioned, simply making sure that you have open scheduling on your website. So the transition away from the old model of have your PCP send us a referral and then we'll get back to you, transitioning into here are the appointments for our specialists on our website. If you need to see a specialist, schedule the appointment first. We still want to have a conversation about that referral and make sure you see the correct provider for what your child needs before you get here. We still want to do all that. We can do that after we schedule the appointment, right? And is the website set up to handle all that? We are not cutting edge on that. But we have done a good job of just getting those most of those consultative type specialty appointments on there. So, and I know you got some other questions to go through here, so I'll stop there.
Fantastic. Yeah, no, I think well, you started us off with a bang. We're still on the intro slide, but you've already provided probably enough meat on the bone for us to get to the hour. That's great. And I think we'll come back to that. And I'm going to double click on that actually with the first question, JD. But Patrick, do you want to maybe introduce yourself now? Tell us a little bit about your role at Boston Children's, and then we'll kick it off officially with the first question for the panel.
Thanks so much. Yes, I'm Patrick Jordan. I'm the Director of Virtual Access and Consumer Efforts here at Boston Children's. For those of you that may not be familiar with us, Boston Children's is a pediatric academic medical center here in Boston, affiliated with Harvard Medical School. We have about 6,000 clinical staff to see nearly 1 million plus clinical encounters per year. And our team specifically looks at how do we use technology to drive forward specialty pediatric care through new models. Can we expand access? Can we elevate pediatric care elsewhere using technology? And can we get our patients better resources? So I spend a lot of my time specifically on that.
Fantastic. Great. So we've introduced the panel. JD talked a little bit about this. So I think I'm gonna just kind of boomerang it back to JD for this one. But what are the main challenges that pediatric care providers face when trying to meet the digital expectations of millennial parents? So you mentioned them not using the phones anymore, JD. That's a great place to start off. And then maybe, again, let's talk about how, not just the challenges, but how is pediatric care adapting to meet those needs of that new generation of parents? And I agree, JD, I think we can change the title of this webinar to include the older tier of Gen Z as well in this entire panel. So let it be known that now they're part of this discussion too. But so some of the challenges, and again, some of the ways that pediatric care is adapting, and we don't have to talk about Gen AI in this question. I think we can make, that's going to be the focus of this discussion for sure. But just in general, some of the challenges and some of the innovative ways that you're tackling those. So JD, I think you start us off SMS. Let's take it from there.
Sure. So I covered some of the basics already. Something else that you had in your slides in the intro that all pediatric health systems are struggling with, of course, is the epidemic of behavioral health. issues in adolescence. And so that looks different. We just broke ground on a brand new building that's going to be 100% dedicated to behavioral health, and that will be doubling the size of our inpatient behavioral health unit and expanding all of our outpatient offerings in that building. And many other children's hospitals are doing something similar. On the IT side of things and AI side of things, I've seen some. We have not yet implemented this. Once again, a lot of this is brand new, but I've seen some very compelling digital therapeutics. If you're not familiar with that term, the FDA approved app, basically, that has to prove that it actually is efficacious in making some patients better before they get to slap that label on there. That's hoping to fill the gap that we all have, where we have lots of kids with diagnoses and behavioral health referrals from their primary care pediatrician, and we don't have that necessarily all the right providers, enough behavioral health providers. And so how do we make sure that these kids are not falling through the cracks? And one way of doing that is to prescribe these digital therapeutics. And of course, the generative AI is very good. There's been a lot written now about how, sometimes people just need somebody to talk to, and the AI can do a pretty good job of that. And the AI can be smart enough to say, oh, this conversation is going to a place that somebody needs to bring this kid into our behavioral health crisis center now, right? And so these tools are beginning to be available. So that's exciting. But once again, brand spanking new. We have not deployed that yet.
Great. Fantastic. Great way to start us off. Charity, anything to add there about challenges and then, of course, ways, that either Cook Children's or other pediatric health systems are starting to overcome them?
Yeah, sure. No, I think JD hit a lot of really great points. One thing I think I would add is that, as we implement artificial intelligence, and that is just such an umbrella term, right? But as we're looking at implementing these really great new technologies, we really need to focus on where our workflows are fragmented, right? And I think that we often see this happen or maybe as a gotcha later. And so we really need to work with our patients and our families. And I think we at Cook Children's really pride ourselves on that. Our digital health team and our IT team work frequently with our family advisory councils and our patient advisory councils, and really hand in hand with our clinicians to understand where do they have friction and where are we seeing opportunities for improvement. And we need to ensure that as we implement these new technologies or we implement AI, that we really look at those workflows and try to streamline them on the front end. I would say that, one thing that us as pediatric care providers really face, you talked a lot about access. And JD talked some about just the mobile users. And so what our parents are really looking for is a personalized care experience that they can get at the tip of their fingers using their mobile applications. And so our digital health team and others really were able to provide an application at Cook Children's. So My Cook Children's is our app, and it amplifies the patient and family experience technology at their fingertips in one application, right? And so this was an app that was developed with other vendor partners. And when you utilize that application, you have the ability to, the ability to send messages to your care provider utilizing our patient portal. But then also in our Prosper campus, when you show up at our Prosper campus, you can utilize wayfinding on that same app, and you can, your inpatient experience when you're in the hospital, it can all be derived from that one application. And so really being able to and engaging your patients and your families and your clinicians in those conversations early, I think has been really big.
Excellent. I think, Charity, there's a bit of cutting out happening. I don't know if it's in the internet or not, but just letting you know. But we did get almost everything except that little bit at the end. But fantastic answer, and I think we'll move on now to our next question. So this is to Patrick, and it came up also while we were talking in the intro, and now JD as well has mentioned it. But Patrick, back in June, Boston Children's acquired Franciscan Children's in an effort, according to the CEO, to do more to address the children's mental health epidemic, which has really been the great tragedy of the pandemic. Can you talk to us briefly about what this mental health epidemic Dr. Mitchell is referring to, and what are you doing to streamline access to mental health specialists to meet, kind of that surge in demand for services around that? And what role is technology serving in this battle?
Yeah, and on my end, it's a bit early on the Franciscan side to speak to that specifically. But I will say, broadly, there's a shortage of specialists, domestically in the U.S. and internationally. Mental health care, psychiatry being a huge portion of that. And here at Boston Children's, we're thinking about that a couple ways. First is focusing on clinical burden. There's a lot of tasks in the day-to-day workflow of clinicians and administrative staff that is not what I'd call a value add. And this is where an area I see generative AI having a substantial impact in the more near term. So things like discharge instructions, a lot of the prose that goes into the work of our clinicians of just documenting and things like that can be error prone. There's a lot of copying and pasting. There's a lot of work involved in that. And we're also facing a large amount of clinical burnout at this point in time. I think addressing that will free up capacity to help with some of those challenges and help with some of the retention and recruiting for those roles. I also think that expanding into the virtual space further, psychiatry is one of our top departments offering virtual visits at Boston Children's, but continuing to do that across many specialties where appropriate is incredibly important. We're seeing more and more that specialists are congregating around regional hubs where there's top academic medical centers, and to reach the folks that have complex kids that live elsewhere, we need to be more virtual forward if appropriate. So we continue to push that. Our virtual visits team here continues to do an excellent job with our specialties, making sure we have a solid footprint to offer that. So if you live in Western Massachusetts, you don't have to pack up your kid, get in the car, have people miss work, drive, park, stay overnight, things like that, if it's not really necessary. And then the other point, I think, is also matching the need and the need for an answer to the correct party to answer that question or need. And there's a lot of opportunity here for generative AI as well. We have a lot of excellent niche programs that are hard to get into or find, and often travel through word of mouth, through support groups or in family Facebook groups. We want you to come into our digital front door and get directed to the correct spot and the correct level of help. Our mitochondrial DNA neurologist shouldn't be seeing just a common headache patient. So we want to make sure that matching is done again to make sure that we're expanding capacity and serving everyone there.
Yeah, I think you nailed it in the last point. I mean, one of the pillars we talked about before as well is ease and convenience of care, and generative AI is an easy way to make sure that routing happens to the right place, that there's no friction, at least in directing them to the actual point of care, and that's something that can benefit across the board. So less burnout, also for on the administrative side, the clinician side. I think that's great, and a good segue into the next question, which is now going to touch specifically on generative AI. So can anyone on the panel provide examples of how generative AI has already improved parent and patient engagement? So any healthcare outcomes you've already seen, and I know a few of you said it was too early, so maybe it's anecdotes from across the industry. But if anyone wants to go ahead and provide examples, and if we don't have those, we can move on to a different segment of this questioning. So anyone want to jump in?
Yeah, I'll jump in. Can you hear me?
Cool.
I'm like, can you hear me now? Okay. I'm at a conference today, so it's like a little bit. No, a couple of use cases that I have heard of other organizations that are utilizing this well is around education, and JD talked a little bit about that. Utilizing generative AI to provide our patients and families education at the, sort of touch, at their fingertips. Personalizing their care, recommending interventions to clinicians is another really good use case. And I think just that transparency with our families and providing them their health information in real time, I think is a good start.
Excellent. Anyone want to add on to either those examples or share some new ones?
I think the number one example that everybody's talking about, and we are not doing it. We're just looking at the vendors now, really digging in deep at Dayton Children's, but certainly some of the early adopters were I was at the Epic user group meeting last month. That was all the talk, and in particular, talking to folks that are leveraging the ambient documentation. So that is moving very quickly. I've been very impressed with the maturity. We have demoed some of these. It's a really cool demo scenario, right? Because you're getting a bunch of people on the phone acting out a pediatric, all the weird things that happen in a pediatric visit, like you got the sibling running around yelling while the doctor's trying to talk to the patient. We like assign roles and act out all these crazy things. And the AI is still smart enough to ignore the stuff that needs to be ignored and document the stuff well that needs to be documented. So the technology is very, very, very impressive here. And because ultimately what it's doing is it's writing a draft that the provider still is going to read and do a little bit of editing on before they sign their name to it and create the medical legal document out of that. We have to be less concerned about any sort of ethical concern or it's we've had dictation for a while. We've had virtual scribes for a while. It's just it's a more efficient virtual scribe, right? And the provider is still legally responsible for what they're signing their name to. So because of all those things, I think my prediction would be that is going to be rapidly adopted, and pretty soon, if you don't have that, your providers are going to say, "How come the other system has that and I don't have that? I'm quitting," And so we're looking hard at that right now. There's nothing pediatric specific about that, but it does in terms of meeting patient and our patient families' expectations for better quality care and more compassionate care. Of course, everybody would like it if their provider walked into the exam room, put down a phone and said, "Hey, AI's listening, but don't worry, I'm still doing the note. And by the way, this means I can look you in the eyeball and pat you on the hand instead of typing in my computer during the visit." And so I think that's going to move pretty quickly. But by the way, one of the vendors that we're looking at, one of their unique features is that the AI is producing two notes, one medicalese note for the provider that's appropriate for a clinical note, and one layman's note that can be tailored to the patient's language. Obviously, it can be tailored to the patient's reading level, health literacy level, and then put into the patient portal. Because there's all sorts of good research out there about how a patient walks out of the exam room just forgot 70% of what the provider. There's really important information that they need to have that the provider just told them, and they were freaked out because they got a new diagnosis and they didn't remember any of it, right? And so this is a really great way of documenting all that in a whole other level than patients have had it before, right? So I would guess that these technologies are going to be adopted very, very rapidly.
Very cool. As the millennials would say, there'll be FOMO in the organizations that don't do it fast
I would
enough.
agree with
That was my horrible semi-joke of the panel. Patrick, what are some of the use cases you're experiencing? And if you want to maybe leapfrog that question, we can move on to, the use cases are very exciting, obviously, but some of the current limitations and challenges of doing a few of these things. So, for instance, generative AI filling in fields within the patient portal or within Epic, or generative AI helping to summarize clinician notes. I mean, what are some of the limitations and challenges that are being faced in pediatric care, in general in healthcare, and how can these be addressed? So maybe legal or, on the compliance side as well.
Yeah, and my colleagues that are working on how they leverage AI, generative AI in the workforce space are thinking about this quite well. And I think that's why we're starting our efforts with what they're calling human in the loop type use cases, where there's a clinician or another person, staff member present as the generative AI is being used. I think we're starting there because of those concerns. This is all new, and healthcare tends to be one of the last adopters of a lot of new technologies. And this really only started to get commercially adopted, I would say, for generative AI specifically, just over a year ago. So we're still very early in that adoption curve for healthcare. So we're starting with how can we use this to improve things like note documentation, using things like ambient listening. We have a good footprint at the hospital on digital scribes. My colleague Tim Driscoll has done a very good job there. And now we're seeing how we can extend that further into these use cases. We worry a lot about the direct patient-facing applications of this until it gets proven out a little bit more. We don't want to let, especially for anything that's sort of clinically adjacent, that in the wild quite yet for compliance or legal or harm concerns. So we are starting sort of in-house on the staff side, see how that pans out and start to think about that there. I think we're much more open to how this can help craft messages like, emails, texts, engagement things, again, with some sort of staff interaction, and are exploring that space there as well. But, those are our main concerns about what will this do with hallucinations? And we also are still a bit concerned about biases, right? These models are built on a lot of things that include a lot of innate and inherent biases, and we want to make sure that we're serving our patients well and universally. So I think that's another area that we'll be continuing to monitor and adjust with our partners as we roll some of these things out.
Excellent point. We didn't talk about bias in AI at all, actually. So really great addition to the conversation. And if anyone else wants to jump in and touch more on those challenges or bring up new challenges, please feel free.
Yeah,
Charity or JP.
Yeah, I would actually echo Patrick. I think that is a really great strategy that Boston Children's is utilizing, leveraging internal legal compliance. I think we all know from a regulatory perspective, this is all still very new, and most likely we'll see a lot of changes coming. And so even though we may be early adopters, there are things that we're going to have to most likely change or update based off of those regulations. But one thing to consider too would be governance, right? So these large, these data models use a lot of data from different sources, and having governance to support that is really important. And so if you haven't started on your governance strategy, I would say that's really integral as you move forward to ensure that you're using the right data at the right time and for the right reasons. And so, I think that's somewhere from a strategy perspective that Cook Children's is really starting, is really looking at governance outside of, our use cases, and ensuring that we are being compliant and that we are also looking at our technology infrastructure. One thing that our CIO Teresa Meadows has often said is it's rarely the technology that's the issue. It's the insurance of that we are keeping our patients safe by leveraging, all of our other resources, right? So our clinicians and our legal folks and the other people, our operations with in Cook Children's to help us as we move forward. And then I think, lastly, we just need to ensure that we're being equitable. So outside of, with that bias rights comes equity. And are we ensuring that we're being equitable from, do our patients have access to telemedicine? Do they live in rural areas where they have, technology or broadband issues? Do they have access to a smart device most of the time? That's yes. But are we providing them the opportunity and giving them equality in the care that they're receiving?
Perfect. So we have governance, we have equity and the democratization of care, and we have bias and hallucinations. So quite a lot on the list, and it's amazing that steps have already been taken to kind of overcome those obstacles as well. So very cool. JD, I think beyond just limitations, challenges, legal compliance. So let's say those were less of an obstacle, right? So what are some of the key factors for you? You mentioned that you're evaluating already for specific use cases a few vendors over at Dayton. So what are some key factors that go into your decision-making process when evaluating a Gen AI vendor? So what boxes do they have to check?
Sure. So on the governance discussion, everybody's talking about that. In fact, there's a group of CIOs at Epic customers that have a collaboration, just an email, but
wow.
that is actually the topic du jour. Probably got 10 emails this morning. Somebody asked, "What is everybody doing?" Everyone's doing something slightly different. I think that partially that depends on the size of your organization. And I can tell you, at Dayton Children's, we're not going to be creating new committees. We're going to be making sure that our existing governance committees, factor in the right things we need to be talking about, right? Because it's not like it's not like we have the staff size to go like create new positions. And some people are talking about that. Oh, I'm going to add positions with such and such skills to do this or that. Well, we're not going to be adding positions. We're just going to have to factor all of this in, and like everything else we do, balance innovation with compliance risks, right? And according, on the one hand, there's some radically new technology we need to be very careful with, and there's medical legal risk, ethical risks, all these sorts of things. On the other hand, we're pretty darn good about dealing with PHI risks, and
right.
we sort of know how to think about these things, right? So yes, the technology is radically new and it offers lots of capabilities, and we have to be careful. But it's just like the example that I was using with the ambient notes, right? That's not a big risk because the doc's got to sign the note anyway. And we're not talking about the AI diagnosing patients, right? That would be something totally different.
Excellent. Anyone else want to jump in on the subject? Just again, beyond some of the more safety measures and things related to the risks, but just some of the other things that go into decision making. I mean, assuming generative AI right now is well governed, there's good documentation in place to follow best practices. I mean, what are you looking for, in a Gen AI vendor? If you'd start that evaluation process, and what are some of the things that are important to you in that space?
I only have two additions to what JD said. So first would be, my preference would be this is baked into other things that already exist, not, a vendor in itself. I prefer that, the functions that we have vendors that power something start to leverage more generative AI in their offerings, because that will already fit into the workflows. And the other thing that we think about, or I'd want to consider, is the IP implications. So and this would be a part of contracting, part of our legal process, but as we help you train your model, how are you learning from this, and how are you using our staff, clinicians, patients' input in that, and how are we protecting our expertise or their input into whatever model appropriately.
Great. And Charity, free to chime in. And if not, we're going to.
Sure. Yeah. In fact, a couple of the vendors that we're working for, we're also looking at DAX for next fiscal year. And I think, and other vendors who really, as we've partnered with them or have decided that we would move forward with that vendor relationship, outside of just ensuring that they are, compliant, and meet all of the check boxes, right? From that perspective, that they are a partner, right? And that there's someone who can scale that innovation quickly and easily, that they have the same considerations both for the patient and the clinician, and that they have a vision, right? And that vision aligns with our vision at Cook Children's, and that we have the best interest of our patients and families and clinicians, right? And also we want to see that they've had some successes and that they have been successful at other organizations, because I think one of the things that we can really do as we look at AI and as we all look to scale our technology and innovation is to learn from one another, collaborate frequently, regularly, and really don't reinvent the wheel, but borrow from each other. And I think that's something we want to look at when we're working with vendors, that they have relationships with other organizations and have been able to meet their challenges, and are prepared for that in our partnership as well.
Yeah, great. I think you touched on relationships are everything. I think you touched on a really important point. Finding a partner that can help you implement safety, that understands the concerns, the limitations, that has success stories, that has success criteria, and it's super important as well. So fantastic all around. I think it's interesting what we talked about with governance also, just if there'll be there's JD's now email group, which is awesome. And you've got the World Economic Forum, which often delivers these, global collaboratives around governance. They did it for chatbots during COVID. And it's interesting to see if one kind of super group will emerge that helps to really make this governance something that's, that's consistent across the board in healthcare. So that'll be really interesting to pay attention to. I think I'll field the last question to the panel, and then we will move on to the Q&A. I know we've got some questions that are popping up in the chat. A reminder, this is a good time to ask your questions if you've got them and you've been holding them in. But last question for the panel that we had been asked by some of you who registered. So fast forward 5 years from now, we talked a lot about millennials and Gen Z now becoming of age to be parents, right? And as those populations continue to grow and dominate pediatrics, so fast forward 5 years from now, what does it look like with generative AI? I mean, how does engagement in general look in terms of pediatrics? And I guess, 5 years seems like a long way away, but time flies, right? So what are you doing to prepare for that? And you can take the question in a lot of different directions. Whoever wants to start, go for it.
There's going to be like this new hot, like remodeled jumbo generative AI thing that takes over the world in 5 years, just because we know that's how fast technology advances. But I would say really just right now we are focused on building an infrastructure that we can scale that innovation, right? That we can start small and that we can build from. And so 5 years from now, I want to be able to have chatbots in my digital front door for my patients. And I want them to be able to engage in their app. And I want them to have real-time access to their data. And I want our clinicians to experience less friction in their day-to-day life, and they have tools like ambient listening and things that are documenting for them. But for us to get there, we have to start building on sort of the bottom of the pyramid, right? And really building on that infrastructure and ensuring that we have our data is safe and whatnot. And so my hope in 5 years is that we get there eventually, and that we can meet the needs of our customers where they're at, and that they don't have to be at Cook Children's to be seen, that we can monitor them remotely and efficiently, and they have quick access to care. So in 5 years, that's where my hopes and dreams would be.
Fantastic. JD?
Yeah, I'll take a swing at that. So I was just a recent industry analyst note just published this month, ranked based on some surveys of leaders at health systems of what people are, the actual use cases, Gen AI use cases, or there are people are either doing or looking at actively. And so, not surprisingly, the ambient documentation we already talked about was number one. I don't think that surprised anybody. But others that were not far behind it and about the same amount of responses. Automated consumer messaging, clinical document auto generation, autonomous clinical coding, and clinical message auto reply. So I think you mentioned 5 years there. I think a lot of the stuff's coming like a year from now. I mean, in Epic world, that clinical message auto reply is available now from Epic. Some of us have to do our next upgrade to get it, but we'll have it at the insurance in a few months. And what that's going to do is, so many providers are overwhelmed by all the queries coming in from patients in the patient portal. Good news is we have most of our patients using patient portals today, and we ask them to communicate with their doctor by sending a message. The bad news is doctors get overwhelmed with these in-basket messages. And so Epic leveraged their existing partnership with Microsoft to their developers really got on top of this early for some of the ChatGPT capabilities. And now it's going to take a look at what the patient wrote. Can I get a refill for these meds? Take a look at what's in the record, generate an auto response. Once again, it's not being sent automatically. The provider still has to read it and edit it and sign it before it goes anyplace. The provider is still responsible. But it's just going to make providers more efficient. And interestingly, when they've done some studies on these things, patients actually prefer the AI answer because the AI answer is more verbose, and the AI is able to just spit out some other niceties and make it longer and friendlier than your average doctor has time as they're banging out a reply about the prescription refill. So that's at least in Epic world, that's coming within the next 6 months to a year.
Awesome.
And to kind of build on that, I think there's a really cool opportunity to really transform sort of the post-care experience here with generative AI. Not just from like personalizing instructions in your care plan and stuff like that, and making that easier for clinicians, but also putting something that allows a patient to interact and get reminded much better than it has before. Classically, it's been like boilerplate text notifications to take meds, things like that. I see that transforming to be something where they can ask questions, get informed answers based on their plan of care or medical records, and that really helping drive outcomes post-care, and that being really compelling. I also think there's an opportunity to make this more universal than it is. A lot of what happens is in English. We serve so many patients that don't speak English or prefer not to, and it wouldn't necessarily be on the burden of a translator to push out in the preferred language and terminology that is understandable. And there's an opportunity, and I think it will happen, to use generative AI to make that difference and really drive impact in communities where we are actually behind in.
Wow, amazing point about multilingual support and also personalization, customization, personalization of messaging, even having a brand identity for the pediatric care center they're interacting with. I think that's amazing. Fantastic. I'll move to we have Sai, who asked quite a few questions, great questions. Some of them were already answered. But I will start with this one. So we all know the Gen AI models are diverse, data hungry to avoid bias. Do you foresee hospitals in a region collaborating with each other to build Gen AI models that can take advantage of local demographics and diverse data into account. So collaboration in regional collaboration to build Gen AI models to take advantage of local demographics and diverse data. Interesting question. Does anyone on the panel want to jump in? We'll do one. So I'll ask a question and then maybe just one answer from one of you.
I'll take a swing at that one. First of all, this is one of the places you have to make it's a bright, shiny distinction between predictive AI and generative AI, right? So yes, we know some of our predictive models, particularly ones that have been based that are heavily biased towards people with health insurance, and which corresponds with socioeconomic disparities, which corresponds with racial disparities. We have big problems there, right? There's so much work that's being done now. The Epic Cosmos database with 200 million patients on it that does actually reflect the demographics of the United States, and increasingly overseas too for the Epic customers overseas. And the models that can be generated out of that can handle some of that. Now, in terms of the bias in the Gen AI, that's more about the what the prompt engineering. Speaking of these terms we didn't have a year ago, right? Prompt engineer and training the model and making sure that the models are not saying inappropriate things at the inappropriate time. I think it's more about the engineering of the large language models for that. So.
Excellent. And I'll move on. I think we have time for one more. So sorry if we didn't get to your questions, attendees. Generally, people do understand that most of the information will at some point be generated by generative AI. So I think I'm going to rephrase this one in a second. But most people basically understand that a lot of their touch points now are going to be with AI. So how do hospitals reinforce the emotional factor in the accounts while communicating personalized messages to patients? So essentially, how do you keep emotion in play while adopting some of these technologies? I'll say for now, most are still on conversational AI, but also generative AI. And anyone feel free to take a swing at that.
I just think that with any type of AI, there's always, especially in pediatrics, right? There is always going to be that human touch because we're not providing healthcare adequately to our patients and families if we're not doing that empathetically and with them. And so you have to think of these tools as an adjunct to the care that you provide every day. They're providing a service. And so you still need a clinician, even or a caregiver or someone who's in the care team to be able to see some of these responses and to act upon them and make changes to them or edit them. Even in predictive analytics today or any type of decision support tools that we have, we still rely on someone to make a decision on whether or not they're going to implement that intervention or not. And I do think there will always be that human factor, and at no point will it completely take over what we do as caregivers or as clinicians with our patients each day. So I think it's just really using it as a tool in your tool belt. And it's not the only one.
Amazing. Fantastic way to end the panel on the human factor note. You three are amazing humans. Thank you for joining us here on the webinar. I think everyone benefited from this tremendously. One thing before we hop off, Hyro's hosting a virtual summit October 26th. We're going to touch on a lot of these subjects in depth across a wide array of segments of healthcare. So October 26th, more news to come. But really appreciate everyone joining us today, and a virtual round of applause for Patrick, JD, and Charity. The three of you were really animated and just amazing today. Yeah. So thank you so much.
Thanks for having us. Yeah, it was fun.
Thanks for having us.
Thank you.
All right. Have a great day.
Bye, everybody. Thanks so much.